Hello and welcome to our webinar today. This is how to use your health coverage. It's our partnership event with the Maryland Health Connection and the Maryland Insurance Administration. We're going to be running this webinar at least monthly and at least through all of 2024. Thank you again for being here. And we really do hope that this presentation helps you understand your health coverage and that you feel comfortable asking questions in this setting. My name is Patty Dorn with the Maryland Insurance Administration, and I'm going to be the moderator and a presenter for this event today. If you have recently purchased a health insurance policy from the Maryland Health Connection, or you're considering purchasing one, you're in the right place. Again, we do hope that this webinar helps you understand the health insurance plans that are offered by the Maryland Health Connection. We're going to talk about basics of the plans available on the connection, and we're going to touch on insurance terms such as deductibles and copays. We'll also help you understand insurance networks, what it means to go out of network, and we'll cover what you can do if you have a problem with your health insurance plan. Just some housekeeping. As you saw, this event is being recorded and it will be posted on the Maryland Insurance Administration's webpage. All attendees should remain on mute for the duration of the event. However, you can use the chat box at any time to ask questions, and I will be hosting a Q&A session after the speakers are finished. Don't hesitate to ask questions. The presenters will speak for about 30 minutes, and the rest of the time has been set aside for the Q&A. And so with that, I would like to introduce our first speaker, Jenny Garrison.
Thanks, Patty. I'm gonna share my screen. Let's see. Can you all see that?
I can see it, Jenny.
Great. So my name is Jenny. I'm the Outreach Program Manager for Maryland Health Connection, and I'm excited to be here with you today. Feel free to chat questions as we talk through a few slides. But our goal is to cover some basics for how to use your health insurance to build your knowledge and understanding. Patty mentioned this, but we're going to talk about the top benefits of plans through Maryland Health Connection and how to use them, the key costs and how that impacts your wallet, and also where to go to get more information. Let's talk first about how to use your coverage. So first you want to confirm that you have coverage. So if you signed up through a plan through Maryland Health Connection, the first thing you want to do is pay your monthly premium, which is your monthly payment. You should get a bill in the mail, but if you don't, you would want to call your insurance company. We've shared the information for the insurance companies on the right here. There we go. Can you still see that? The next thing you want to do is find a doctor. So what's happened for your wallet is that if you are looking for a provider, which is a doctor, a nurse, or a licensed medical professional, you want to look for a doctor that accepts your health insurance, which is considered an in-network provider. And in that case, in order to find out if they're an in-network provider, you would talk to the provider themselves, call their office. You can also check with your insurance company, and Maryland Health Connection also has a tool online, which we have linked here, which we can send around after this presentation so that you can see that as well. So look for that in-network provider to lower your cost for services. So now that you've confirmed your coverage and you've found your provider, you want to use your core benefits. We'll outline the core benefits that are offered through all plans in the next slide. And we're also going to talk through preventive services that you can get for free. And free. I didn't know this until we started, working on the concept for this presentation, but all of the plans offer preventive services for free, even before you have to meet your deductible. And so let's talk about the core benefits first, and then some of the preventive services that you can get for free. So all of your plans cover these benefits listed here, which are the core health benefits that we see used most in our community. Preventive care, emergency care, maternity and newborn care, pediatric care, medications. All of these benefits are covered, and we have it all listed in detail more on marylandhealthconnection.gov. Preventive services for adults are covered as well. So your regular wellness visit, some of the screenings that you see listed here, and then counseling along with certain preventive services that you might need are also going to be covered. Vaccines. Likewise, we have additional preventive services for women that are covered. Your annual Well Woman visit is covered for free, which includes a full physical exam. And then some of these other key services that we know is needed by our community members, including services for women who are pregnant or who may become pregnant. Again, when you check out marylandhealthconnection.gov and you look at there's all of the preventive services are listed out. So if you have something specific that you're looking for and you want to know if it might be free, you can check our website. Similarly to adults and women, there are preventive services available for free for children. I just took my 2-year-old for his well baby visit, and well child visits are also free. Vaccines for children from birth to 18 are covered, as well as screenings and assessments for development and key health services that they would need. Check out marylandhealthconnection.gov for the full list of services that are available for free for your children. Okay, so we have all of these free services that we know are covered. We know our plans offer core benefits. So the key health benefits that we are going to need are going to be covered. So let's talk about the cost that we start to see with our health insurance. So we talked a little bit about this in terms of making your first premium payment or your first monthly payment. So the word premium is what the health insurance industry uses for their monthly payment. So just make sure that you stay on track with your monthly payment or your premium so that you get to keep your coverage. Another key term that you're going to see with your health insurance is a copay. A copay is the cost that you pay at your doctor's visit when you go for a service that's not a preventive service. So I mentioned that I took my 2-year-old for his well visit, but let's say that he got sick, which he did get sick at Thanksgiving. So then I took him to the doctor again for a sick visit. Sick visits aren't covered for free, but they're a core benefit. But a copay is a cost that is a set amount by the insurance provider or insurance company, and you pay that amount. So when I took him for his sick visit, it was a $15 copay, for example. So every time I go to the doctors, I know that I may have a copay. And when you have an in-network provider, which we talked about, you will have a different copay, which is usually less than the copay that you would have if you have an out-of-network provider. So that's another way that you would save a little bit of money at your visit, knowing if you had an in-network or out-of-network provider, is by looking at that copay. Let's see, more key costs. Your co-insurance. This is a new term for me. So fortunately, some of our colleagues are on the line who can explain it more in depth if you have questions. But a co-insurance, to my understanding, is your share of the cost of a covered healthcare service, calculated as a percentage of the allowed amount for the insurance. So a copay is a set amount that you pay at visits, whereas a co-insurance is a percentage of the cost that you are required to pay. And then your health insurance pays the remaining percentage. So for this, for co-insurance, a colleague was telling me recently that her diabetes medication was covered 90% of the cost of her diabetes medication was covered every month, but that 10% of the medication that she needs every day is not covered by her insurance. So for my colleague, when she's doing her budgeting, she has to include an amount in her budget for the diabetes medication that she knows she needs every month, and her co-insurance is 10%. So that's something that you want to look at as a cost when you're looking at your budget, because if you know that you have more medical needs and you have monthly needs or weekly or daily needs, you want to include that percentage into your consideration for your budget. Then let's talk about a deductible. A deductible I often associate with car insurance, because you know that you don't always use your car insurance, but when you get in an accident, if you need work done on your car, then you have to meet your deductible before your insurance will help you pay for the repairs. And usually that's a set amount for your deductible. Similarly, for your health insurance, you have your preventive services for free, and your visits and certain visits are covered, but then certain things aren't covered until you meet your deductible. And each of your health insurance plans are going to be different in what they cover before the deductible and after the deductible. So that's something you would talk to your insurance company about. But then you also want to look at what your deductible is, because if you need to go for a certain visit that's not covered before your deductible, then let's say that your deductible is $100 for a year or $200 a year, then you know in your budget, you want to make sure you have budget for that $100 or $200 deductible for the year. Because if you have to go to the doctors for a non-preventive service, then you would need it. So let's visualize this a little bit more. So you have your deductible, and then you have your out-of-pocket maximum. So now I feel like we're talking about a lot of things that are out of pocket. You have expenses out of pocket. So the out-of-pocket maximum is the most you would pay for your services in 1 year. So you meet your deductible and you make co-insurance payments, and those are out of pocket or in addition to your premium. So those payments can only reach a certain amount every year, and that's called your out-of-pocket maximum. And here's the visualization that helps me understand. So you're going to pay for your full cost of your health insurance before you meet your deductible. Then you reach your deductible, so you made that payment. And then you have any co-insurance for services that you have a co-insurance for. And then all of those costs together, they reach a maximum. And so that maximum is called your out-of-pocket maximum. Does anybody have any questions about that? Okay. All right, one other top tip that we have here, and we're assuming that maybe you already have your health insurance plan, so you can sort of see where your plan falls on this chart. But in terms of how you're budgeting and how you're looking at your costs for the year, usually it's this silver plan that we offer extra cost sharing reductions to help you reduce your out-of-pocket costs like deductibles and copays. So when you're looking at your plan, if you haven't selected, or if you're going to reconsider for next year, you can look at a silver plan as an option for additional savings. But you can see, if you have a higher monthly premium payment, you are paying more every month with your monthly payment, but then through the course of the year, you're likely going to face lower out-of-pocket costs. So that's kind of how these metal levels are designed. So you can sort of see, where if you want to pay more every month, knowing that you go to the doctors pretty regularly, and so you want to limit your out of pocket, or maybe you don't go very often, so you want to stick to a bronze plan and just use your preventive services. And then if you have to go for out of pocket, you may have a higher cost. So that's sort of the concept of metal levels. Another top tip is a value plan. This is also new information for me as we were working on this. I didn't know about value plans, but value plans are offered through Maryland Health Connection, and they offer lower deductibles and useful coverage for more health services before your deductible is met. They're specially designed plans to help you lower out-of-pocket costs for the healthcare services that we know the majority of people use frequently. And all the visits will still include those core benefits that we talked about, as well as, doctors and specialist visits, and urgent care and more services before you meet your deductible. MarylandHealthConnection.gov is our website. I think I mentioned it a few times, but you can get more information on everything we've discussed, including value plans, at our website. Oh, perfect segue into this slide. And also we're here to help you. So we do have a pretty cool feature on our site, which is a virtual AI assistant. So if you put in a question, the information that comes back is shockingly accurate. So I definitely recommend trying the chat bot. We also have a call center. We offer services in more than 200 languages. We have a really great service called a Broker Connect. So if you know that you're going to go in a private plan and you want someone to really help you go through some of the nuances, you can reach out to one of our insurance brokers who are local in Maryland. And if you fill out our form, someone will call you in 30 minutes or less. Usually it's about 15. And then additionally, we have consumer assistance organizations throughout the state that offer free in-person help to help you get enrolled. And if you haven't signed up yet, you still have until January 15th to enroll. If you enroll before the end of this month, if you enroll by December 31st, your plan will start on January 1st. But if you enroll after January, you still have the first 15 days in January to sign up, but then your plan would start in February. All right, so still time. And I see this excellent reminder. Thanks, Becca, that value plans also have diabetes care benefits at a $0 copay, which is a good point for my colleague who has her diabetes coinsurance. So let's recap. And then if anyone has questions, please drop it in chat. And please feel free to share your feedback in chat. And do you want to pop quiz? Maybe tell us what your biggest takeaway from the presentation was. What is one preventive service you may use that you didn't know was offered? And do you know where you can get more information on your health insurance? It's MarylandHealthConnection.com. Anybody have any questions? I'm going to put my information in here. So if you want to reach out, if you have questions, feel free to send me an email. And I'm going to turn it back over to Patty.
Hi, everybody. I'm Patty Dorn with the Maryland Insurance Administration. I'm going to do the second part, how to use your health insurance, part 2. And so I'm going to focus on what you can do if you have a problem with your plan and you want to file a complaint. Again, my name is Patty Dorn. I'm the Health Insurance Administrator. with the Consumer Education and Advocacy Unit of the Maryland Insurance Administration. So what is the Maryland Insurance Administration? We're the state agency that we regulate the business of insurance in Maryland, and we regulate these plans. We regulate the plans that are sold on the Health Connection. We license all insurance companies that operate in Maryland and the producers, so the agents and the brokers. We make sure that they follow the laws. We make sure that they have the money to pay your claims. So we monitor the solvency of the insurers. We review the policies that have been issued to make sure that they follow the laws. And we review the insurance rates, so those premiums, to ensure that they're not inadequate, but that they're also not excessive or unfairly discriminatory. And important, we investigate consumer and provider complaints and allegations of insurance fraud. So we are an entity that you can come to if you are having problems with this insurance plan that you purchased from the Maryland Health Connection. So the types of complaints that our Life and Health Unit and Appeals and Grievance Unit can review. In general, we review complaints involving health benefit plans that are delivered and issued in Maryland. So that means the ACA plans that you're purchasing from the Maryland Health Connection. For claim denials based on medical necessity, denials of all or part of a claim for other reasons, appeals of a carrier's denial, and other possible violations of Maryland's insurance laws. So hopefully I'll clear that up as I go through these other slides. So those denials may include a claim denial. This is where your carrier or your HMO has denied payment for a service or a medication that was provided. It was denied. You think it should have been covered. You can file a complaint with the Maryland Insurance Administration to investigate. You should not be afraid to file a complaint with us, and your insurance company cannot in any way, shape, or form hold this against you. If you don't think that you should have been denied, you should be comfortable coming to us and filing a complaint. The denial may also include an authorization denial. This is when a medication or a treatment requires a referral or a prior authorization from your healthcare provider, but this authorization has been denied by your insurance carrier or HMO. Again, you can come to us with that complaint. You are entitled to a written denial unless you or your provider agrees to an alternative care plan. If your healthcare provider tells you that a certain service or medication is necessary, so your doctor has told you it's necessary, but your health insurance carrier or the HMO denies your claim, that is a denial based on medical necessity. Your healthcare provider has said it's medically necessary, and you have the right to appeal that decision. In general, first, you file a grievance through your carrier, so your insurance company, before you file a complaint with us. However, in some cases, if it's an emergency, for example, so you have a compelling reason, you can come to us first. So before you file that grievance, in certain cases where it's an emergency situation, you can come to us and straight to us without filing that grievance with your health insurance company. In addition, you can file an appeal. If you were approved for a lower level of care than you asked for, or you believe that the in-network provider or approved provider is too far away, or the wait is too long, or you received an approval for fewer visits than your healthcare provider thinks you need. Those are all reasons that you can come to us, and you can file a complaint and we will investigate that complaint. So the appeals and grievance process begins when a carrier, your health insurance company, renders an adverse decision, which includes a determination that a healthcare service is not medically necessary, appropriate, or efficient. So your health insurance company has told you that this service is not medically necessary, appropriate, or efficient. So you, the member, or the member's representative, if you have a representative, or your treating healthcare provider on behalf of you, has the right to protest this decision through the carrier's internal review process. and then ultimately through us. So again, when a protest is filed with the carrier regarding an adverse decision, they've said, no, we don't believe that you need this treatment. That's called a grievance. So you're filing a grievance. If the carrier again determines that your proposed or delivered healthcare service is not medically necessary, you, the member, a representative of you, the member's representative, or the treating provider, your doctor, on behalf of you, may ask the Maryland Insurance Administration to review the carrier's grievance decision by filing a complaint. So again, in general, you file that complaint first through your insurance carrier, and that's called a grievance, and then you come to us. But remember, in many, many cases, you can always come to us first, and you can always contact us and say, hey, can I come to you first? And certainly in an emergency situation, you can come to us first. So what the consumer needs to do to receive assistance from us. Complaints can be filed online, and that link is below, and that is a relatively easy process. You can also snail mail them in if that is your preferred method. You can find the forms on our website and you can print them out. You can fill them out by hand and you can send them in, and you can fax them as well. You mail or you fax your complaints directly to us at the Maryland Insurance Administration. Attention Consumer Complaint Investigation. That's with the Life and Health / Appeals and Grievance. And we're located at 200 St. Paul Place, Suite 2700, Baltimore, Maryland, 21202. Our fax number is 410-468-2260 or 410-468-2270. We have them separated. They are the same fax number. With regards to which group you're going to end up in, is it life and health? Is it appeals and grievance? That is not, as a consumer, all that important to you. You just send it in and we get it to the right place. This is our online complaint portal. It's a little bit of a small screen picture on the side. That's what it looks like. If you do have a disability, you can file your complaint by phone. And in that case, you're going to call the Maryland Insurance Administration at 410-468-2244. So if you have a disability and you need to file that complaint by phone, the patient's signed consent is required for an appeals and grievance complaint. So if you do in those situations file by phone, in some way, you're going to have to get a signed form to us. 24/7 for medical necessity and emergency appeals. So please remember that. We are available 24/7 for medical necessity and emergency appeals. If you don't know whether we would classify this as medical necessity and emergency appeals, you just call this 24/7 number and we will assist you. There is somebody available from MIA at all times, even on the weekends. That's 1-800-492-6116. Again, if you don't know whether or not you should be utilizing this particular number, call and ask. There's somebody there available 24/7 to answer your questions. What you should expect as part of our complaint process. After you file this complaint, you're going to receive an acknowledgement within a few days. You're going to be assigned an investigator, and you can call that investigator at any time with questions. The life and health contract complaints, those can take between 30 and 90 days to resolve. The MIA first writes to the insurance company, and then the law allows them 15 days to respond. So that's where it can take some time. In general, they do respond relatively quickly, but whenever there's a back and forth, they get an additional 15 days. So this is just us saying sometimes these are resolved very quickly, but it can take between 30 and 90 days to resolve. The appeals and grievance complaint investigations are concluded within 45 days unless there's an extension of an additional 30 days granted. But again, there is emergency procedure as well that goes a lot faster than the 45 days. I just wanted to show you, we do have some additional resources in videos. The Maryland Insurance Administration makes a lot of YouTube videos. We have a pretty great YouTube page. We have a video about appealing a denial of services. So essentially what we're talking about here with regards to medical necessity. If you just want to go to YouTube and watch that video, it's a 3-minute version of what I'm talking to you about now. And also specifically for medical necessity and emergency appeals. So you can find those links here. We have a video on mental health parity, and that's just something to understand. Mental health equals physical health with regards to what your insurance company needs to pay for you to be covered. So your mental health is equal to your physical health in your health care plan. And the other video that I have up here is provider networks. That helps you understand in-network and out-of-network and the rules with regards to in-network and out-of-network. And I do recommend any of these videos, and they're all pretty short. They're all just a couple minutes long. We try to make it something that most people will actually watch until the end. So we try to make them short and sweet and kind of cute and animated. We have documents, brochures, how the appeals and grievance process works. Again, if you're somebody who would prefer to read instead of watch videos and you need a review of this information, you can find it there. A consumer guide to using your health plan. That is actually, I don't know how many pages long it is, but it's a 20 to 30 page guide that really goes into using your health plan. If you want more information, I highly recommend reading through that. We have a consumer advisory requesting an out-of-network provider. If you're in a situation where the in-network provider cannot treat your condition, is too far away for you to travel to, or cannot see you for a long time, or whatever your determination of a long time is, you can request to see an out-of-network provider. And this consumer advisory helps you with that. And for each individual insurance carrier, it shows you what their specific process is for requesting to see an out-of-network provider. And then the last one here is understanding medical necessity. So what does it mean for something to be medically necessary? You can find that information in the brochure here. So with that, I am considering this the Q&A portion. It doesn't look like we have any questions in the chat right now, but if you do have questions, I encourage you to put them in. We'll give it a couple minutes. All right, well, seeing that there aren't any questions, I do want to thank you for being here today. I hope that you would feel comfortable reaching out to us at the Maryland Insurance Administration, as well as the Health Connection with any questions. Again, we're going to continue this series throughout the year, so you'll have many opportunities to join us. And if you are interested in receiving my slides, I'm going to go ahead and put my email in the chat so it's easy to grab. That way you can click on those links to access those videos and access those resources. So it's right there, patricia.dorn@maryland.gov. So you can just shoot me an email and request those slides. Jenny, did you have any closing comments?
I do not. Thank you very much, Patty.
You're welcome.
Excellent information, very informative. I'm going to put my email in chat too, so
Okay.
if anyone wants the slides, they can email me too. Thank you. Happy holidays.
Yeah, you too. Yep. And thanks for being here. Again, we're going to do this several times, many more times through 2024. So tune in with us. You should see that advertised at the Maryland Insurance Administration's website, as well as the Maryland Health Connection. Thanks for being here, everybody, and happy holidays.